soft tissues, teeth, and the bones. You know, from the classification, we again come back to the previous classification, like the odontogenic inflammatory process. You remember when we start from pulpitis, continue to periodontitis. In traumatic injuries, and we have the same classification, but we have three big groups as the injuries of the soft tissues, injuries of the teeth, and the bones. Of course, we have the big group about the complications. What about the teeth? What do you think? What's the most, what the first level or the first, the name of the injuries about the teeth? Damaged? Or?
Upper teeth.
Teeth. Remember, again, we come back to the past. What's the complications maybe start when you extract the tooth?
Fracture or fracture of the crown.
Fracture of the crown. What do you think? If it happened, what we should do? How to understand that it started? How to understand that the fractures of the crown present?
You will see the
You
crown.
see,
Like
In the
change the configuration of the anatomical crown. Yes? How to help the patient? It depends on what? On the level where present fractures. First, we need to understand the level of the fracture. It may be horizontal, maybe vertical. For example, if it will be like this one, possible to use the restoration? Yes. If it will be like this one, possible to use restoration?
yes,
But before restoration, we need to preparing endo. Or we need to choose between the crown and between the filling and between the
in the
restoration.
crown.
If the fractures of the root will be like this one, possible to save?
Yes.
Unfortunately. How to diagnose this? Of course, you use the extraoral examination and intraoral examination, but very important role from the all investigations is the how to understand the level. Or now we use more CT scan to understand where is it really, to preparing the patient for the normal treatment. It's like the horizontal line of the fracture. Understand what I mean? If it will be the same situation, but the fracture will be like this.
The same extraction.
It's not deeper like this one, yes, but we have
Vertical.
two
Towards
than one because touches the bifurcation zone. Unfortunately, what we did, extraction and immediate implantation. If we discuss about the fractures of the root, if the fracture line will be like this one, possible to save this tooth.
Yes.
Yes,
But what we should do before?
The extraction. The part, the small part.
We need to
endodontics.
understand the real thickness of the jaw. You remember how we treat the chronic form of periodontitis. Very easy if it's single root, yeah? Why? Because the thickness of the jaw there. It's too closer to the vestibular cortical plate. It's not deeper position. It doesn't mean when we check like this one, for example, this thickness, not more than 1.5 or very rare 2 millimeter in diameter. It doesn't mean when we open it, there we can see the real good observe of the operative area. Understand what I mean? If we discuss like this one, lower jaw, first or second molar. What the thickness of the jaw there?
Big.
Or more. Understand what I mean? When you're planning something around this, you need to understand where will be the real operative access. Imagine, we have one ball inside my hand. If we want to extract this ball, my hand has thickness. But if my hand will be the thickness more, like 2 or 3 or more, you need to open more. Understand what I mean? Because the thickness cannot help you to understand, to observe the operative area. Understand what I mean? That's the first reason. And the second, more dangerous, we remember, where is it? The real nerve and the artery. If you remember that we cannot use access lingually, remember it. Why? Now we know that there are 2 stages of the floor of the mouth, yes? Superficial and deep, or first and the second. It's absolutely muscles. You remember it from the abscess and phlegmons. And artery and nerve, the same has position too closer to the operative area. Why we never use lingual access if we discuss about the surgical preparing or surgical procedure for treatment of the chronic form of periodontitis. Understand what I mean? It's not the abscess and phlegmon. It's the planning operation. We cannot use it lingually. Why we use always superficial access? It doesn't mean vestibular or buccally, if we discuss about the upper jaw. Okay, what we should do if it's single, like this one? If we have the fracture of the crown, the same? The same? If it's deeper, the same like the horizontal. We unfortunately need to remove and put inside the implant, if it's possible to do it now. If the fracture will be around the apex, which technique? Apicectomy. If it's in the center, the same like previous, the same like extraction. Understand the technique, how we choose the treatment plan. It's not from my imagination, it's from the biology. Unfortunately, if it's some patient has the traumatic injuries, has the fracture of the root, but if it's like this one, what happened? It's 2 parts and not connection. In some literature, it's maybe 25 or 30 years ago, was a small case report about why we cannot use the metal to closure, to fix the 2 broken parts. It's impossible. Why? Because you remember periodontium. On this area where will be the fracture, what happened with the periodontal ligament? It's destroyed.
Damage.
And thought, what's the process?
Fiction.
inflammation. Understand the rule. If it's localized in the apex, if it's single rule, we can use apicectomy. If it's multiplied, we don't use it, unfortunately. You asked me, Nina Alexandrovna, but when you said that we have the hemisection procedure, it's the same technique of the treatment, surgical treatment of the chronic periodontitis. Or on this, for example, we can use coronal radicular separation, the same, if you remember. But what's the difference between chronic mechanical trauma or chronic periodontitis and acute trauma? Time. If it's happened now, what starts there immediately? Inflammation, yes, and
Pain.
yes, it's the symptom of inflammation. But what patient cannot do,
chewing,
don't want? Chewing and
mastication, brushing.
what happened there? Locally forming like the abscess. Understand what I mean? If it's chronic periodontitis, the cell is dead before we can planning. But if it's fresh socket, I mean, it's small time, 1, 2, 3 days, it's impossible to use, unfortunately. That if what type of therapy we can use? Conservative and surgical, and the surgical. Understand what I mean about the surgical? Extraction or extraction and implantation. It's only about the tooth. How to preparing tooth if we want to say 100% and therapy. 100% and therapy. Then we wait. Then we use, it's like the dispensarization. It's like the long control of the patient more than 1 month. 3 months, you remember, yes? 6, 9, and 1 year. If it's good, goodbye, yes? And control after 2 or 3 years. What technique we can use for control? What you used previously. Why? If you use before X-ray, then you want to check on CT scan. How to check it between each other? Understand what I mean? We don't know really what was before. If you use X-ray, use X-ray.
History.
Yes, it's for history, to understanding the right or it was right or was wrong technique and how we check the patient after. Not bad situation for the patient. No. About the teeth fractures. Yes, if it's possible, we can save. If it's not possible, we cannot save, but we want to use immediate implantation, or sometimes we can use the same immediate loading there. What the prognosis for the patient? Not big time for the treatment, yes, and it's like the predictable for the patient. Understand what I mean? Yes. Perfect. If we discuss about the bone, how many days does the bone regenerate? How many days a socket regenerate after tooth
3
extraction?
months.
No.
It depends of the patient.
10 to 14 days.
2 weeks.
You're right. What about the bone regeneration? Of course, we not discuss because we start with the injuries, yes? We continue with the bone regeneration to the next, I hope, to the next semester. Yeah. What do you think? It's not one socket volume. No. If it's bone fracture, it doesn't mean we have two or more fragments who has space between each others and immediately start damage of the nerves, of the blood vessels. Understand what I mean? How many days we need for regeneration, the bone? Physiology.
Maybe 3 months.
3 months.
2 to 3.
3 months after that, we will do implantation. I'm just listening to the YouTube a lot.
3 or more. It depends what we did
Depends
before.
on-
Yes. If it's some predictable procedure without screw, without osteosynthesis, yes, it's 3 months. It's good. How to understand that the bone regenerates?
X-ray. CT scan.
We don't see the empties between these spaces between the fractured bones. Okay, I prepare for so many interesting slides about the trauma. Sometimes, I miss the big trauma.
Doctor, what technique do you use for regeneration of the bone?
What do you mean?
I saw some like metal they used to fix the bone for do a regeneration. It's like this.
Yes, it depends on the situation. Sometimes we use the splinting when I'll check it. And how to understand what technique we need to understand, what we need to use, it depends on the type of the fracture, the fracture, and how many fragments on the fracture. If it's single and the patient has a teeth or tooth, we can use the splint technique, if it's possible. It's the part of the osteosynthesis, you ask me, yes. And the osteosynthesis, we have to use the combination. First of all, what we need to, palpation. It's very important.
Yeah.
If it's about, we discussed about the teeth, for teeth, more important percussion. For the bone fractures and for the soft injuries, palpation. It's a stupid situation because you really need to palpate the patient. Why we need to understand? Why we need to palpate? Because your fingers, it's like the electrode to understand. Yes, because under the fingers you understand the same level like previous, the same like from the both side. From if we discuss about the trauma, about the fracture, very important to understand and to answer for 5 questions. Where, how, where it happened, how it happened, was bleeding, no bleeding, was loss of consequences or no, and the last one, was treatment or no. Why? Because we need to understand where is it happened. For example, in the job, in the working, in the office, for example, in the street. Because we need to understand how was it clean. Understand what I mean? How it happened. What was the traumatized agent?
Causes.
Yeah. Because if it's like the needle, it's sharp and small. We need to think that the wound area of the
Well healed.
it was small but very deep. If it's big, it doesn't mean that after the trauma we have the big damaged area, but it will be like it's wider but not deep. Understand what I mean? If it was combination we need to understand maybe bleeding on the post-operative period or maybe later bleeding, because we know about the characteristic of traumatized agent. Of course, we don't discuss about the war situation, because if we discuss about the shotgun, yes, about the shotgun, we have the specific what you can see, because it's the high speed, it's high temperature, how looks the wound area. It's very important. Sometimes patient cannot answer, because patient maybe at what condition?
Paralysis.
For example, paralysis. What's the next reason of why patient cannot answer? It's maybe traumatized on the tongue. Yes, it's impossible. It's impossible. Or maybe the patient lost
Consciousness.
yes. But how looks the wounds helps you to understand what happened. Because sometimes people find different or other people with this situation without consequences, and how to understand what really happened. It's about how it happened, where it happened, and how long, what's the time of this period. Because you know, ideally period for treatment, how many hours after? It doesn't matter what we did. For example, we extract the tooth. It was the trauma for the patient. Yes? Yes. We recommend what need to do at home after 2 hours, after 1 day, after 2 days, after 3 days. It's normally it's the same. In the fractures of the bones, very important to start the therapy as early as possible. Why? Of course, we have some many bones, you know it. Maxillary, zygomatic, mandible, orbit.
To correct the position.
What? Okay, correct the position. It's the other type why we need to use the splinting, why we need to treat the patient. But what the idea?
To avoid the next step of treatment.
Because we don't want to lose a lot of blood.
Sometimes after 2 or 3 hours, blood finished bleeding. You understand what I mean? Bleeding is finished. Yes, that's right. Destroyed the vessels, destroyed the nerves and the bone, and start the inflammatory process. Understand what I mean? And if we're planning to do it now, osteosynthesis, but after fractured, after the time when was fractured, more than 2 weeks, it's impossible to do it now. Understand what I mean? Because which type of process start? Which diseases from my mouth you hear so many times? What's the osteomyelitis? Why it happened? Destroy the bone, inflammation, and no good position, no covering the zone, and microflora from outside,
Penetrated inside
from the
deeper.
skin, from the oral cavity, going deeper and start the osteo force. Yes, about the complications. Okay. Two guys discuss with each other about what's the color of the sky. One said blue, one said deep green. No, I said blue. Other said no, deep green. No blue, no deep green. Drunk. How many minutes need to take that the patient take the fracture? What do you think? What will be the position of the other guy that after the discussion patient has fracture of the mandible, for example, what do you think? It's possible like it will be like me and discuss with the tall man. Possible that after the discussion, after my arms, the man tall has the trauma of the mandible.
Yes.
What was my direction for the, how it was? It's, can you take to me, yes please. You will be my mannequin, sorry. Yes, understand? No. Understand what I mean? What will be? On this period, guys, like this one, and maybe only touches by the ear. Understand what I mean? If the patient, or not patient and the doctor, sorry. One guy taller, one shorter. If I taller, what will be? It will be the same like this one, because it's like the physiology, it's like the reflex. You understand what I mean? Yes, oops and no, nothing. But it can happen, yes, thank you. It can happen, it would be like that and like this. Why? If we know the point of empties. What does it mean, the point of empties?
The point of fracture.
How many foramen has mandible?
Mental.
2 mental foramen and 2 inferior alveolar.
Alveolar, yes.
Where present inferior alveolar process?
In the ramus.
In the ramus.
In the ramus.
In the lingual side. You remember, not superficial. Where the mental foramen?
Here.
Superficial. And if your pressure will be in the same and the line will be like the straight, understand what I mean? Not undulated, not like this, and you touch the foramen, what happened with the bone? It's not a joke, it's the real situation.
I'm not
Because sometimes 2 guys, it's like the playing, understand what I mean? And after this playing, we have the fracture. What?
Ah, it's fraction, doctor.
Yes.
We just.
Why?
It's a weakness point.
Because the foramen is the space.
The medication.
Inside this space, it's the nerve, it's the soft
It's
structures.
the same of glasses in the bus. Or like
Yes.
if there is some.
Yes, it's true, it's the same technique. Why very important to understand it? If it happened, we don't discuss about the fight, please. Technique. We discuss about the technique, how what happened after. Okay, George. That's the first, the anatomical foramen. Do you remember the embryogenesis? Yes, of the maxillofacial area. What has happened? We have two parts growing together, touches with each other and start the growth. Understand what I mean? We have by physiology the line of the pressure. What does it mean? The line of the pressure. You discussed it in topographic anatomy. Remember, the line or the line of the force or the line of the pressure. That's the synonym. What does it mean? The line of the pressure, or it doesn't mean when 2 vectors, horizontal and vertical, has point of touches. How looks perfect mandible? Has the body of the bone and has the ramus. When it touches together, change the line of the forces. Understand what I mean? When it's communicated, what about the thickness of the structures as the first, and the second about the function on this area? Why we have the same on the upper jaw. Around the canine, it's first, you understand what I mean? Because it's like the arch. If it's like the mathematics, it's like this one. It's the third, and then about where this. Distally to the third molar. Finished the chewing function. Finished. It's the line when the function of the chewing stopped. Then start other function. Understand what I mean? Who control the motion, the movements?
TMG.
No.
Muscles.
Muscles, it's like the god for the oral cavity. Because we have different position of the muscles. Control, of course, this head as the reflex, but the muscles, it's like the god. Why?
Because he controlled everything in our cat.
No.
Elevation.
I control
So
all.
elevation
Because this is the most
The
strong.
weight of the muscles. What do you think? What the real
So
weight of the muscles? Do you see at the normal anatomy
The patient. I mean,
the patient? Yes.
No.
No?
it's so.
Do you see the meat at home?
عمرك شفت حد ميت؟
Yes, of course.
شلته؟
It's the same. The weight and the pressure so higher.
شلته.
And it's controlled there. And if it happened, for example, this, what happened? One muscles did one function, other like it was previous, but it's not together. Understand what I mean? If we discuss of the situation why all fractures localize around the mental foramen, about the angle, about the TMG,
Yeah.
where will be the biggest pressure? In the condylar process. Why? No. No. Why?
The pressure on the angle.
No. It's fixed, guys.
Fix it.
Understand what I mean? It's fixed. It's two separate parts fixed together with the ligaments and with the capsula for function. Okay. Which muscles touches there? The point of attachment, masseter, and it's the superficial, I mean vestibulary, from the lingual, middle pterygoid. What about the sublingual space?
Sublingual.
Lateral pterygoid.
Lingual.
The borders of the sublingual space.
Floor of the mouse. Genohyoid.
Mucous membrane of the floor of the mouth. It's the superficial layers. Malachioides, yes. If it's like this one, like this. Sublingual, submandible, and submental. What do you think? The pressure and the thickness of the masseter will be the same like the muscles who attached lingually? No.
So bigger than the
It's absolutely different functions of the muscle. Why we need to understand it? When fractured start, in which direction fractured part?
Downward,
No.
left, right.
Which muscles is there?
Masseter.
Masseter, it's more bigger than pterygoid.
Pterygoid.
Yes. What's the function of this?
Elevation.
Elevation. Understand it? It's how the fragments change the direction. Why very important to use the palpation? Just a second. Back. Can you see how it palpates? We need to palpate the orbit. Then we need to palpate the zygomatic bone. Then temporal, TMG, yes, and the nose. Why? Fracture of the bone of the fracture of the part of the nose. You understand it because we have the cartilage part and we have the bone part. And then we use intraoral palpation. Why? We need to palpate from the tuber to the center. Why? If it's like one part without no spaces, you understand it, yes?
Touching, you feel the pain.
Sometimes patient feel no pain. No, special if it's lower jaw, for example, about the mental, or if it's present fracture of the mandible,
because he lost
because
the
it
sensation.
destroyed the
Sensation.
inferior alveolar nerve.
He lost the sensation.
Yes, and the nose sensitivity. Okay, it's the answer how we fix. We use the special splint technique with the metal, and we use the special ligaments to fix it to the right. There is the modified part. It's like the round. You can see it how it looks like the round, but we use this one. It's like the hook position. Okay, how patient looks intraoral. It's the real situation. The guy discussed with other guy what will be perfect for the woman of that guy. And after that, who want to understood the other guy about his girlfriend? Take this one. What's the main complaint of the patient, guy?
He cannot eat.
Fraction in the mental,
The function is
in the mental area. That's why elevation. So they should do fixation in this side.
The complaints.
He cannot eat. He cannot speak.
First,
function.
the bleeding, guys.
Yes.
Pain and bleeding. Then, immediately muscles control. Yes, and what happened with the small fragment?
Elevation.
Elevation. That's right. What we can see inside? Patient cannot close the mouth. It's the other complaints of the patient. Bleeding, pain, cannot open, cannot close, cannot eat. Eat.
And the area we will have a
What do you think?
we will have a sensitivity because one side closed and the other no.
Doctor, the other side side it's not open because the muscles is like damaged. He open his mouth and the other side it's still closed because the mouth is
Yes,
damaged.
yes, that's right. The direction, the fractured bones or the fractured part change the direction from the normally. And how it looks, we know if it's there where the line of the fracture. Remember it, yeah? It depends on the muscles. Why we firstly start with abscess and phlegmons to repeat from the previous course about the topographic anatomy. There can help you to understand why on this direction the fractured part changed the location. What do you think? How many times after the trauma there?
3 hours.
1 day, 2 days, 10 hours, 1 hour, 2 hours. How many days?
1 hour.
1 day.
It's immediately.
Last.
If it will be immediately, will be the bleeding. Can you see the bleeding? Blood clot, can you see inside? No.
Doctor, I think 1 week because they don't have damage in the soft tissue.
Maybe there not you can see clearly, but there the plaque. It's around 1 week, 10 days. Yes. It looks like normally. Yeah, really. But it's not normally. What do you think? In which department we can treat this patient?
Maxillofacial surgery.
Yes. Sometimes it happened at the polyclinic. The guys come back to you with this, maybe 1 hour after.
Doctor should treat it
What we should do
straight
there?
away.
We have immediately medical, how to say, immediately emergency, no, immediately.
Emergency.
No. We have first aid, yes. What we should do like a first aid? We at the polyclinic. We need to check. Where is it? Really?
Mental.
The
mental area.
Yeah.
No. Doctor, it's 2 area. Mental area and in the point of
Angle of
connection. Angle, yeah.
Can you see how to fracture three
So this
fracture
looks like that.
change the direction? Can you see it? This and this. How many? Previous. Can you see it? Of course, in OPG it's not the same like this one, but two fractured line. What does it mean if you can see this and this? It's like the two lines.
Like merge of the lines.
Yes. What do you think? What does it mean? What does it mean?
It means he just kick her 2 times.
The time
No.
of the fracture is long.
The bone has thickness, and the line of the fracture vestibular and the line lingual not will be on the same direction. Understand what I mean? If it's one direction, they change the position will be like this. If it's not the same direction, when vestibular between this and lingually deeper, it's not like the straight line of fracture. It's always not like the straight line because the jaw has angulation and has the thickness. What do you think about this one?
It's mandibular, like you see, between the arms and the body of the mandible.
Why the fractured part not change direction?
Yes.
This.
The thickness is the same.
Line of fracture.
Because the fracture through the socket and the tooth
Fix it
sometimes fix
Fix it
it,
inside.
especially if it's two roots. If it's fractured line
Inside the
localized
location.
between the two roots, it will be on the same fixation, on the same direction. No change. If it's single and to the center of the socket will be the same, medially and distally will change. Understand what I mean? It's very important. Why? Because for this, you saw that fractured line, only this one. Yes? Interesting, yeah?
So,
What we should do? Of course, we need to use the first aid. First aid at the polyclinic. Take off the pain and intra, extra, and special. Then what we should do like the first aid?
tie
We fix, doctor.
the face.
refix and
At the polyclinic, it's not new, but at the polyclinic, we need to use this one. You a doctor. If you at the first, you need to splint to reposit the jaw to the right position and fix.
fixation.
It's like the first aid. If the patient has the dislocation of the jaw, we cannot spend the time when the patient go to the maxillofacial department for the treatment of dislocation of the jaw. It's the same, real the same. You at the first who meet with the patient, and from the first examination, take the final diagnosis, then of course clean how it possible the wound area, and then reposition to the right position and fixation. If you met with the patient with this and you don't use this, what happened after? Patient thought, no therapy. Okay, maybe I need to wait. Because sometimes it's not like this. Understand what I mean? Sometimes it looks like normally. This one. Can you see where the position of the line of the fracture?
Here and
Between which? It's
between 7 and 6.
it's the lower jaw, yes? Between first molar and the second molar.
7 and 6.
What do you think? This tooth helps to reposit the jaw to the right position.
We will remove it. Extraction, and after that we
No. If the foreign bodies between the fractured line localized, we need to remove it as the rule. If the tooth has the root and this root not yes, we need to remove it. Sometimes, if it's possible, of course, we want to save the tooth or the teeth. You know, if the patient lost the teeth, it's the problem will be for the patient and for you. And the teeth, it's like the part where we can fix the splint technique. Understand what I mean? It's not the surgical procedure. It's the first aid of conservative therapy or conservative treatment for the fracture of the bone. Understand it? It's more clearly now what we do.
Doctor,
Your question was about the osteosynthesis. In which type we can use osteosynthesis? For example, what you can see there, guys, a dentulous jaw. No teeth upper and the lower jaw. No. Patient has used the prosthodontical constructions. Which type? Partial,
Complete or partial?
full partial construction for the upper and for the lower jaw. Sometimes we can use the special technique with the ligament, mental ligament, and we fix to the mental ligament. It's the jaw. I don't have a picture, I hope, for this, but I don't load it. But we need to discuss. Can you see if no teeth, how to fix? You can reposit, but how to fix? Yes? If you can use osteosynthesis, like you said, with screw and the titanium plastine. We see it later. We have the picture about it. But if we don't have the titanium plastine, how to fix the jaw? Is the jaw as the nerve? We use like the ligamentum, and this like this one. In one. Understand what I mean? It's from one part. It looks like this. One part. And then we suture it. Its ligament looks like X from this part. It's from outside, in outside and inside. Yes, thank you. And it's like, do you remember how we suture? The same, yes. And we have, yes, one from this, and then combination to each other. Of course, better for the patient using the osteosynthesis. But osteosynthesis is the general anesthesia, general anesthesia, and long period for
treatment for the healing.
Yes, for the healing. That's why it's the big operative access. I mean the flap design. You know now how we open it. Yes, can you see it when we open submandibular, for example, access and phlegmons, the line of the access, or when we use the angle 2. That's why we can choose between each other type of the treatment, because we need to use more predictable for the patient, especially if it's adult patient. In which situation patient has the fracture of the bone if the patient is adult? For example, a patient used full partial construction last 25 years. What the thickness of the jaw? Patient going in the winter to the shop, want to buy bread, and has a accident. Yes, if it will be enough to break the jaw. Because the thickness, yes. Okay, next one. Here, can you see how many fragments? Of course, you can see the red lines, yes? But we have 2 lines of fracture and how many fragments? 3. What do you think? What's more sorry.
Bigger.
1 week in the big conference talking in the Russian language, I forgot all Russian language words and all English words, sorry. What's more dangerous for the patient for the treatment? Which part?
This part,
No,
this part.
this part. This you can fix.
Yes.
But how to fix there inside the TNG? Sometimes it's impossible.
It's not that
And the patient live with this all life. It regenerates something, but we prefer to fix. Yes? How to fix? We use the osteosynthesis, the same. For example, this is broken. We use extraoral access there and open the angle of the jaw. Open the angle of the jaw. Then use the drill like this one. It's about, I hope, 8 centimeters. And when we open the jaw, we can see the thickness. We drill it
from here, like
from
that?
here to usually around this one. Then we use the metal or titanium big screw and use like this one. Understand it? Before, when we use the drill, I mean the piezodome, or before we use the piezo dispenser, we use like a mold there
Like that.
to fix one
مسمار بتدقه في الحيط.
big and one, yes.
Doctor,
Yeah.
the name of the technique.
Osteosynthesis. It's the all osteosynthesis maybe with titanium plastin, with the screw. It's maybe like the bone suture with the metal ligament. It's not the name of the technique. It's not the distraction osteosynthesis. Distraction osteosynthesis, I show the picture how it looks.
But sometimes when we use screw, when it
Screw,
goes,
yes, yes.
the part of the bone, like the bone, go up. How we will fix it now?
Now we use to access.
From this.
Yes.
No, that's not special.
Yes, so we use to access, to control. Now we use the technique with endo. Endo can help you, endoscopic I mean, helps to understand the position, real position. And if it's possible, if you understand the TMG, the capsula, it's too deeper. And when you cut it, capsula not regenerate, you understand it? Why we afraid if we use straight access, it's not happened. You can fix it, but a joint, TMG,
Maybe damage.
not maybe damage. The TMG cannot working, and it will be what's the bad situation for the patient. The name of diseases of TMG.
Ankylosis.
Ankylosis. You remember it's a trauma. Start like the arthrosis, continue with the like arthritis. No, start like arthritis, continue like arthrosis, and the final will be ankylosis.
Two fracture.
Two fractured line is the right answer. Because now we're preparing for the exam, you know it too. For this exam we meet it again at the same time with crazy teacher. Yes, we have two. What do you think? What was the reason? This one and this one. Where was the pressure?
Here. And
If it will be from this one, where was the fracture? In TMG.
It's down.
If it will be like this one, it will be immediately mental foramen. Where? Do you know the like this one? It will be like this. Because if you remember, the jaw has the form.
Over.
Yes. And if you pressure to the oval, to the from the both side, this part going down, this, you remember the line of the forces? Yes, will be this. What do you think? How to fix these tooth? How to fix this fracture? And what we should do with two retained teeth? With two third molar from the upper jaw. Not upper, sorry, lower jaw.
We can conserve the tooth. It's the root. It's normal.
Why we need to palpate?
this is impacted.
Do you see? Change the direction. It doesn't mean that the ramus change the position, change the direction. There, nothing, and this one. Can you see where is it will be? There. Where will be the inferior alveolar channel. Can you see?
Should be like
Yes. How to fix it? Possible to use this splinting like we saw with the metal?
No.
No. But we use the splinting for the osteosynthesis. Of course, when we discuss about the type of the therapy, about the surgical procedure, very important to understand which technique will work right. Splinting, it's the first aid. It's like the emergencies for the fractured. Sometimes it's enough. It's the conservative therapy. But if we understood that it's impossible, we need to reposit the jaw. Jaw change from this like this one. Understand? We need to put it and to fix. On this, the said molar cannot help you to reposit to the right position and to fix. On this, possible or no? If you can see, no, it's not like this. Wi-Fi.
You want a bigger?
I don't have access for Wi-Fi. Only student have. Can you see the small pieces as the foreign bodies? It's impossible to take away these foreign bodies. We need to extract the said molar too. Yes. Understand what I mean? Why we so clearly observe the X-ray to find all small details. It can help you to treat the patient. Yes. Next one. Is the situation after? We remove the said molar. It's not the same. It's not the previous. Previous we use the osteosynthesis. We see it later. The same. Can you see? Why we touches the patient to understand to find this. Yes. Here we can use it was the fracture only from the one side on the angle, and we use the splinting technique. It's easy technique when you use not forming splint. It's you use only the what's it? Orthodontic ligament, metal ligament, and you fix it tooth by tooth to the right. Yes. How looks the osteosynthesis? Can you see the splinting? Yes, as the splinting and the osteosynthesis. It how looks the screw titanium? Yes, and with titanium screw and the same configuration like that. It was the same because the fractured line start in the area when was the said molar. Understand it? Like it was said molar here. First, second, and the third. Second, no, but we remove the said molar.
The period of the treatment.
The period of the treatment, 28 days, patient closed the mouth. 28 days, 4 weeks. 4 weeks this splinting, and splinting we can use the rubber small tube. No, it's not the tube. It's like the orthodontic elastic. and we like the resin elastic from upper to the lower because they have a hook, and we fix it to the right position. Why very important to fix the jaw or to the right position? Because you save the bite, you save the occlusion, and the muscles helps you on this. If it will be not on the same occlusion like it was before, the muscles working, understand what I mean, and want to remove to the right position to the muscle, for the muscles, understand it? This one, it was car accident. Not car, it's the velocipede car. Bicycle situation.
Bike.
Interesting. It's like the Terminator. How many fractured line was?
4 or 5, doctor.
1, 2,
3, 4, 5. 5.
6, 7, 8, 9, 10.
5, yes.
30 minutes on the road. On the bike. 30 minutes on the bike and this one. Patient lost, was massive bleeding. Because if we can see only X-ray, but you understand that it's not injuries only. Teeth, bones, and soft tissues too.
Доктор, эти кольца тоже титаниум?
Yes, that's all from titanium. Sometimes we can use the Liger surgical steel, but now we don't use it anymore. We use the titanium screw and the titanium, because on the medical steel sometimes happened like an allergy reaction. We don't understand. Now we change it.
Bio and regeneration, help regeneration fast.
Yeah, yeah. It's lighter, but it's lighter and thinner, and very important to use, because you understand that patient can feel under the mucosa this all. Understand it? Sometimes, of course, from this we don't remove it from this. From which area we can remove? Because it fixed there, vestibulary. If it's nervous and the patient feel it, we can this, and that no. This more. We closure the mouth for 28 cannot open. Sometimes if patient want, we use the gauze, like a Hippocrates cup, you know it.
Yes.
Because of course patient want to eat. It's terrible situation. Patient cannot, but you know now it's very interesting that the electronic devices helps us to protect the secondary caries and pulpitis and periodontitis when the patient has splinting, because it's small gap, it's electronic, and the patient use the oral hygiene. The big problem one, impossible to use lingually. This is the big problem. Sensitivity, you mean?
Yes. He just feel like the salty or...
Sometimes the sensitivity, the nerve growing, we know it, but the time is very long. Sometimes it's more than 2 or 5 years patient cannot feel. You know that the complications after osteosynthesis, can you see where is screw? Inferior alveolar nerve, mental foramen, the same. Foramen of inferior alveolar nerve. Patient may be lost for all life, but we save the life and save the normal function and normal condition of the maxillofacial region. Of course, patient suffering. This man said that it's impossible. I hate the bike, but Of course. Why we need to use a special Schlimm. Why? For this one. But this, what do you think? In where direction was was trauma? On which direction?
Like that.
Yes. What happened? They lost the control of the bike down, and patient down like this. Understand? What's the very hardest structure of the bike? Руль как вот. Yes, you understand what I mean.
Yes.
This hard part where it controls the direction, and he has like this one. Thanks God, no upper jaw.
Doctor, this is all GLH doctor who did this?
Yes, maxillofacial surgery department. Yes, we work 6.5 hours. We open 3 surgeons. It's not one. It's impossible to do one.
With the help of each
3 maxillofacial surgeon. Yes, we work by the team. Yes, and then come back to ours. 4th and suture the cosmetic. It was horrible. We start at 10, at 9. At 9 was general anesthesia, and finished about 7, I hope. I finished earlier because we screw. Then come back to other doctors. I said it's impossible to stay. But the patient's crazy, real crazy. You know, some people has a problem. They go to the bread and has a problem. They go to the library and has a problem. This guy, this. Once pop, you can stop, he said me. I said, what do you mean? When you breathe at firstly, you live for 100%. I said, I saw it.
And this is from a long time?
Yes, it's a very long time, yes. Now we don't use anymore this type of screw. Can you see it? Now the form of the screw, like this one. Yes.
So in case if he lost the bone at all, like a part, for example, he goes under the car and like, what will you do in this case? He lost all. The bone
We
is fine.
use this one. We use this one. It's the metal
It's
construction.
like after ankylosing.
It's not like after ankylosis. After ankylosis, it's different.
Like
Can you see how, where is it fixed? It fixed at the real bone. Now we have artificial part of the jaw.
That's what I
It's
want.
like on
Yes.
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 I just
Now it's, you know that now it's so interesting field or area of the reconstruction because we can use the computer technology for reconstruction. We use this one, we analyze the normal.
We do the same
Yes.
as the tooth bridge or
Yes,
now we do control.
yes. Especially if we have CT scan before. Some patient has CT scan. Understand what I mean? If implant was, for example, was CT scan before? Was. Okay, refresh again what we discussed. We discussed the trauma, the fractures of the lower jaw, osteosynthesis, yes, spleen technique, yes. What do you think? What there? It's the same. Are you seeing it now? It's the same X-ray. X-ray is not OCG. It's not the panoramic. It's the angle type of X-ray. What you can see? We can see very good. What the jaw? Yes. Both sides. What we can find on X-ray? We can find the inferior alveolar nerve channel. Yes. We can see the tooth, upper jaw, lower jaw. Yes, and we can see something new. It's not the typical picture of the bone. Yes, we need to find something new. Why we need to check all? Because it's very important to understand in which part structures, the bone structure is destroyed. Understand what I mean? It's not typically picture for the normal bone. No, it's not look like this one. No, it looks like this one. What do you think? What is the reason of this? Again, we palpate it. We can see third molar, yes, and the line, what we discussed, when the line through the socket, and you can see like the two levels of the fractured line. It's not. It does. This is not two fractures. It doesn't mean that the superficial line of the fracture has different position like the lingual part of the fracture. Understand what I mean? It's not straight like this to separate. When you X-ray, it will be only one. If the line has the angulation, but it one fracture, it's the same one line of the fracture, but has the line of the fracture has angulation. On OPG, it looks like this, like the two levels of the fractured line. Understand what I mean? If you take this X-ray on exam, how to answer, how to explain what you can see. I can see upper and the lower jaw.
Yes.
I can see the teeth from the upper and the lower jaw. I can see more the angle. Yes? Then I find the change of the picture of the normal
Structure.
Reposition of the
normal bone. Yes, where is it? It's localized around
The
third molar. First, second, third molar. When you check the X-ray and find this picture, it doesn't mean it's one fractured. It's one fracture, but two fractured lines, because vestibular and the lingually, it's not the same direction. Understand? Only one you can find. One fracture, two lines.
Yes.
Vestibulary and lingually. Any fractured.
One.
Fractured two lines. Four. Understand what I mean? And fragments, how many? One jaw, guys. One jaw. I see it. It's the round. Understand how we check? One line.
one fracture,
two lines. Because the thickness, vestibulary and the lingually, not will be on the one direction. If it will be like this, you can find on X-ray two lines. Understand what I mean? Then the same from this. It may be straight, or maybe the same like this one. It will be the same, not in one direction, the line of the fracture. How many fractures? Two lines, maybe four or maybe three. It depends on direction of the fractured line. How many fragments? Three. Understand? You have one potato and use one knife to separate for three parts.
Yes.
How many line of separation was? Two and fragments? Three.
Okay.
And the line of the fracture will be on the same direction, in the one direction, or on the different. But when you can find it on X-ray, it doesn't mean that it's two fractured line, but one fracture. Understand? Okay. I hope.
Me too.
Me too. Okay. Check on exam. This.
what you see.
What is it? Again.
X-ray, panoramic X-ray,
Extraoral
extraoral
X-ray.
extraoral
لازم
X-ray,
بتقسم ازاي؟
Type.
panoramic, not frontal type.
يعني ده واحد وده اتنين
Panoramic.
Yes,
تلاتة.
it's panoramic. It's a dentulous jaw upper. It looks like this one.
And we can see lower jaw,
Yes.
the teeth of lower jaw,
عندنا أول
Yes.
and no.
Prosthodontical construction. You can see the bridge. Yes.
Yes.
Yes. Fixed construction. Next.
We can see teeth of upper jaw.
Yes. Those jaws.
Yes.
Yes.
And we can see.
How to understand that no teeth? Maxillary sinus. Can you see? This is the nose. Foramen piriformis. Remember it?
Yes.
Perfect.
What's the structure in the middle between this and the
This?
Yes.
It's the vertebra.
Yes, yes. And we can see two abnormals in the one in the right and one on the left. It means that there are two fractures,
Mm-hmm.
one in the right and another in the left. And
Where? From one side. From the left side, from the third quadrant. Where is the fractured line?
in the angle of the mandible.
This is the mental foramen. Yeah.
Yes.
6,
Seven.
7. Between 7 and 8. Yes. This one. Where is it? The same mental foramen. Second premolar. To the area between the second and first molar. Yeah.
premolar.
The same. What is it? Inferior alveolar nerve. The same. It's canal, yes. How to understand that the present? It looks like this, the same, like normally. But when you check this
There is no.
and this, can you see the direction
Continue
of the
this.
inferior alveolar
It's just
nerve? It's
reposition of
impossible.
the-
Yes.
3 fragments.
3 fragments, yes. Yes, please.
We do
We check all, I have so many. Yes, please.
We do extraocular X-ray examination, and we see upper and lower jaw, and we see the teeth of upper and lower,
Yeah.
and we see two fracture.
Where is this fracture?
Between between second and third molar.
From the socket of the third molar. Understand? Okay. And how many fractured we check?
3.
Can you see how clearly here you can find the TMG? Normally?
No.
Why no? Yes, normally. Can you see the fractured line? No. No. In the same position where was normally. Glenoid fossa, alveolar,
Candela process.
candela process. Yes. Fractured line there. Fractured line there. What change? The position of the
Of the jaw.
yes,
Of the jaw or the
Doctor,
of the jaw
we have
and of
fracture
the.
in this area.
No, it's not the fracture, guys. What do you think? What is it? It's the same from the both sides. Yes, that's right. Yeah, that's right. Super.
What about this?
Are you start for preparing for the exam? I heard. Yes. Okay, the same again.
Doctor, scapula or clavicle?
Clavicular,
Clavicle.
scapula, clavicular. How many? Two fractures. How many fragments? 3. 3. Okay.
Doctor, there is another fracture I see.
إن هو
Where?
هو كده الجو
Now
متقسم
it's not
لثلاثة، فاهمة؟
Can you see that they change the direction of the lower jaw?
الفريجمنت دي اللي هو ازاي؟ متقسم كده.
What is it? What do you think?
What?
What the bone has, it's not normally positioned because this no on OPG, you know it. In normally OPG, it doesn't mean that the patient not stand like this, has the, как это вынужденное положение? No.
Laying.
No. Вынужденное положение. Сейчас я проверю. It's if the patient has 3 fragments like this, what happened with the big fragment? The big fragment changed the position and has distally and deep. What happened inside the oral cavity? Soft tissues change structures and the tongue has upper position. And patient cannot be like this because they feel like the asphyxia. Understand what I mean? Change the breathing and the patient sit like this. Why? These all structures localized there. It's the... Вынужденная забыла как. Все слова забыла, все. На пенсию мне пора. На пенсию в Швейцарию.
الحالة دي فريلانس على أساس الجو ولا على أساس المكان؟
Приезжайте. Вы будете работать, а я буду на пенсии.
تمام. بعد بقى الأسئلة
شوفي هو عمل لك خليهولك كام قطعة.
خلهولك كام قطعة دي أنا عايزة أعرفها. يعني خلى الجو كام قطعة بعد ما الفراكتشر
Forced situation. Understand? Forced. Because when you use the OPG, you stand like this one and fix between the upper and the lower jaw fixator for the bite. If the patient cannot stand like this, they stand like this. And when the OPG going, all hard structures localized. What do you think? What is it? When you ask me.
This one.
What the name of the bone? Name of the bone.
هايويد بون. مايلو هايويد.
Bone.
لا دي
Bone. Which muscles from the lower jaw has attached to the bone?
Investing fashion.
The name of the bone.
هايويد بون.
Atlas axis.
هايويد بون.
Hyoid bone. Yes. And the structure is they look like this, like the birds fly. And when the patient changes the position and sit like this, it's the X-ray cannot has the straight. It's the between the view and between between the apparatus change the line. It's not the correct and it's really bigger than normally if it's not correct position of the patient. Yes, please. With red. Yes, please.
Panoramic X-ray.
Extraoral X-ray. Extraoral X-ray. Yes.
Then we have
the type. Extraoral X-ray. Then the type.
Panoramic
X-ray. Then
then
it's like the scheme to answer. Understand? How many times we repeat, we have this right answer. Because it's the same like you write the case report, the patient case report. It's the right diary, what you can see. Extraoral X-ray, panoramic X-ray, then
we have in the upper ear, in the upper ear in this side and this side unerupted teeth. And I see
what fix?
Fix what?
Fix on the teeth.
Splint.
Splint fixed. Splint fixed from first premolar to first premolars upper jaw, from first premolar to first premolar lower jaw.
To the second premolar in the lower jaw.
To the second, what I said, from the second to the second, the same, yes? 10 teeth upper jaw, 10 teeth lower jaw.
So we have here extracted tooth?
لا.
Yes, it was the same time because can you see? It's not finished the regeneration of the socket. Usually, in which time we can did the X-ray before treatment, immediately after fixing the splint, and from 2 weeks, then from another 2 in 28 to 35 days after,
When you just open
then
the mouth.
after 3 months. How many X-ray we have? Before, in the day of operation, after 2 weeks, after 2 weeks, after 3.5, 5. You need to write about each other in case report what changes from 2 weeks, 2 weeks, 3 months.
So I advise you to do implant because the upper 6 will follow in the future.
They change the palatal part because it's when you can see the direction, or you can see as they change the position of the first molar. Usually, first change the palatal part because it's easier, and the chewing, the pressure chewing. Interested this one?
This is this one. We have
Vocal impact.
Fractured line
fracture in the
through the
Third molar.
retained third molar. Compacted.
But we should remove it.
Vocal impacted.
In which time we need to remove impacted tooth or teeth? If it's localized in the same area where fractured line, and if this tooth stop for normal reposition, it's like the foreign bodies between. We remove it in the same period when we use splint technique, first aid. Understand what I mean? Because it's like the stop for normal position of the tooth and for the fix to the normal position. If it's possible to save, no complaints, no pain, no nothing, you control the patient. Patient treats at the department. You see the patient 1 week, 100%. In which time we can, by the rule, extract the said molar?
Okay, so
horizontal. It's
pain,
horizontal.
pain, inflammation, or
How many? 5. When will be 5th X-ray? We understood that the forming of the bone finished, the bone formation, the bone regeneration finished, and we can remove. One rule: if patient can
open the
open the mouth to you for observe. If it's impossible, we wait another, usually 2 months. And if we need to remove the tooth from the line of the fracture, we're planning that we need to do, like this one. We're planning after 3.5 or 5 months. It's individually. Understand what I mean? Because imagine, stop the process of regeneration. Now start the process of mineralization. Understand it? And you did a trauma. What happened with the jaw? Stop the process of mineralization. Usually we wait. We have a rule. If it's the fractured line was in the teeth row, understand what I mean? Between the teeth. And when we need to remove something, we wait 3.5 4 months. If we need to remove the wisdom tooth in the same area, if was the fractured, we wait 5. Yes, if it's impact. If it's not impact, because you know what complications usually after of the tooth extraction when impact tooth. Flap design, drilling, then cutting, then separation, then removing, then sutures. If it's possible to you, you understand that the patient, like crocodile, opens the mouth. Really, because sometimes it's impossible. We forgot about the muscles, how muscles answer.
Can I ask question?
Yes.
The 38 tooth, I can see the root.
It's impacted.
It's impacted, yes.
So how I can see the root?
You can see it.
You cannot see, it's not
lingual.
forming now.
It's going lingual.
I know.
It's
I know
maybe,
lingual.
if you're planning to extract, you need to use the CT scan
CT
to
scan,
understand where is the real situation. Because I see only the crown localized buccally. Where is the roots? I don't know. Maybe not forming yet. Maybe forming but localized lingually. It's not like this. It's like this. From like this one. And you need to planning how to remove it. Of course, usually I remove last 10 years said molar impaction. Doesn't matter up or lower jaw, only with CT scan. Because on CT scan you find so many interesting. I removed 2 weeks ago 2 molars set up and low. We're preparing for Господи, как они? For bracket system. Yes. I remove upper. I have this one, only OPG. I remove the said impact said molar. 4 roots. One like this one, real, like this, and one like this, distal.
If like this,
It-
separate.
Thanks, no need. But I understand when I use the movements that it's not the same like usually, because you give the power from the forceps to the, or from I give usually use the no, elevators or periatom I use for tooth removing. And understood that no movements palatally, no movements buccally, only one movements distally, deeper to the throat, like it's really worse. On OPG it looks like this one, straight vertical situation, but really I remove it like this, because the distal two was this. I open, patient has the x-ray, we use it for preparing for consultation for bracket system, and I open it, but when I remove lower jaw, one root, thick and the big, the same,
One root in the
one root on the lower jaw, 4 upper, 1 lower, usually by the rule, 1 upper, 2 lower. Sometimes said molar has 5 roots, really, and the thickness will be absolutely different. For example, usually if the said molar has 3 roots, one it looks like the first molar, 1 palatal, 2 buccals, and 1 palatal will be so short and thin. It's like the spicula, small one, like a needle. And when you remove it, you need to check, because you see, not finished, something broken inside. Especially when you remove said molar, please use CT scan. Understand and discuss with the patient why you need to use CT scan. It's not your money, it's the same for the patient, really. Yes.
If I extracted this tooth, this look like you extracted that have two roots in other direction, and having the pressure of the mandible, this situation.
It's impossible. I can touch the mandible. How I can touch the mandible?
Because the direction for moving to another way in the
Patient close the mouth. If a patient open and you give the pressure, it's not enough. You understood that it's not enough space to control your then patient change this and buccally have more spaces for the instrument, and then it's hard, yes, it's not easy, but when you remove the impact from the upper jaw, impossible to use the bore machine. It's no space to fix inside. Why it's a big problem? Okay. Yes. Yes.
48 here extracted or what?
48 was extracted before, yes.
Not for a long time, yes, maybe a week, 2 weeks ago.
No, you can see. This is the full ball. No, it looks like the same. It's the typically situation in on X-ray panoramic. Why we use the CT scan? But no, if if the socket is finished for regeneration, can you see the difference? There's no cortical plate. Can you see it? This cortical plate, yes.
What is this? Is a black color inside. What is this? What is this?
Nothing.
Nothing.
Nothing. Nothing. Can you see the structure? You can see structure inside. For nerve, and you can see it's like the sponge inside. But usually it's in the angle. It's typically like a defect of OPG. Why you need to understand the normal structures and to see
Lines.
Okay, your.
We see doctor. I see extraoral X-ray.
Okay.
Panoramic type.
Okay.
I see the upper jaw, lower jaw teeth. I see.
Why we need to explain that you see? It doesn't mean you understood what you need to find. Understand what I mean? Not find only the fracture and doesn't matter what inside the oral cavity. We check all, and then finally we have the diagnosis. Yes, please.
I see a fracture after third molar lower jaw.
On the angle of the lower jaw, yeah.
And the angle.
Destroyed
The first foreign body. I
Yeah.
see initially extracted.
Small pieces, yes. Oh, and
We will do it splints.
Yeah, we see endodontic treatment with
we see the chronic periodontitis on the first molar lower jaw. Yeah.
yes.
With the big area of distraction, this chronic granulating periodontitis. Yes. What you can see else? The line of the fracture. Yes. And the foreign bodies. Unfortunately, for reposition, we need to remove the said molar. Understand it?
Yes.
What is it, guys?
Caries.
It's a pulpitis.
Pulpitis, yeah.
Can you see the line of distraction and the pulp? It's the chronical pulpitis. Sometimes, in what happened was trauma. Patient organism need time for regeneration. We close the mouth because we can use the splint technique. What happened with the second molar from the right side? Pulpitis. Welcome. In which time we can treat the pulpitis? It's the sharp situation, yes, of course, because patient, okay, 1 day, 2 days, 3 days with the analgesics, but it's not the treatment of this. We need to treat the pulp, yes? Open, for example, mechanical and medical, not finally repairing. How to understand that we can treat pulpitis on this case?
After healing the fracture. Because he can't open the mouth.
We need to check. We wait 2 weeks after the splinting.
Because in
And if
endodontics,
the patient-
he will open the mouth for a
Yes,
long
and
time.
if the patient can open,
For a long time.
we can take away the elastic for the time of and therapy. Then come back again.
And in this period, use analgesic or
Yes.
Mhm.
Usually the fractures has two complaints from the patient. You treat the fracture, splinting technique, and for the post-treatment period, only two complaints: cannot open and cannot eat. Usually you prescribe for 3 to 4 days the analgesic, of course for 10 days antibacterial therapy. I'll downloaded the scheme about the antibacterial therapy for this one, and then it's enough usually. Then we only wait, only wait.
Doctor, in this case, he has
Yeah.
a fracture.
Yes.
He can't open the mouth.
Why he can open?
Because I see that fracture, it's like in
Can you see the TMG
I see-
from right to left?
Yeah.
Normally position
Yes.
of glenoid fossa and the process.
Yes,
Yes.
normal position.
Patient can open, but not for full.
Yeah, I mean muscles. If he open, he have like dislocation of the two parts of jaw.
Can you see where will be fixed the masseter? Where will be the point of the attach? Masseter. Here.
Yeah, around that.
Here. And the line of the fracture will be inside the masseter.
So the masseter
Understand?
will hold it.
Understand? Yes,
Right.
masseter vestibular can, but of course it's the individually. This we finished with masseter, you know it, angled without masseter. But this, it's not the straight like this one. Understand it? It and the angulation. Why these two reasons that the small partial cannot change for full the position. First, it's the socket, yes, and the muscles. If the fracture will be like this, upper, understand it? It's by the angulation, because the masseter finished there. You remember it. Where is it?
So treatment splint and osteosynthesis. Yeah?
Yeah, here, yes, because it's impossible. You remove it and you have the space, empty space. You splinting all, you need to splint all to fix to the right position, but there, yes, osteosynthesis.
Doctor, the condyle here, I think it's changed. I think it's not
Or
like
it's glenoid fossa
glenoid fossa and then condyle.
here, and the condylar process is the same area,
It's the same.
like to the other side.
Doctor, when we see the normal TMG, we can depends. It depends the opening of the mouth or not. Yes, it's not depends the fracture or
No.
depends the fracture.
Angulation of fracture.
Angulation of the fracture. We start with the muscles. Why? Because you know where is the point of attached the muscles. If the line will be inside when one muscles, like for example the masseter, they fix vestibulary this. But if it's change, like the ungulated and the deepest, you have the two, because masseter cannot cannot control
All sides.
distally, and if it will be free from the part where the other muscles fixed, the contour muscles start to action. Because you know we have the muscle who open and who close the mouth, who helps to change the direction. The lateral and the yes. And when one start to when one finished, others start. Understand it?
Yes, I have a question. I have a question in the previous case. In the steps of the treatment, we start by splint.
Always it's the
Yes.
first aid,
And
yes.
the second,
In the same time, we use the splinting,
Yes.
and we needed to remove the second molar and the first molar.
Mhm.
This one, because it has the exacerbation immediately of the inflammation. Understand what I mean?
Mhm.
First aid this patient. We remove said molar, remove first molar from the said quadrant, put the splint. Understand it? Then we're planning after 3 to 5 days to fix the jaw with the osteosynthesis. If it's impossible to do it now, if it's possible to do it, we do it in the same time. Usually it's impossible because trauma, it's early morning or night time. We need to preparing the patient and to preparing, yes. And we use after 5 to 1 week the osteosynthesis, ideally in the same time. Splinting immediately to the and fix using the osteosynthesis. Yes.
Okay, this is my question also.
Okay, it's yours, please.
Start extraoral X-ray.
У него свой телевизор.
Extraoral X-ray.
Yes.
And panorama.
Yes.
Panorama, and we have lower jaw and upper jaw, and upper teeth and lower teeth, and we have a fraction in the between the first incisor and second incisor between it.
We don't have first and second incisor. We have the lateral incisor.
Yes.
Central and the lateral
Yes,
and
central
the
and central.
canine. Yeah.
Yes.
What about upper jaw?
Where is the
Upper
central?
jaw.
Where is the? Okay, oh, it's just.
Where is the? What about the upper jaw?
We
Can you find the incisors? What was happened?
Box.
Dislocation of the teeth.
There is box push.
What about this one? This one and this one? Two central incisors, I mean the central and the lateral from the second quadrant dislocated. Canine destroyed. Can you see? Only root inside. And then the line of the fracture on the second premolar. The tactic. Splint was, yes, but it's not successful if you can use only one this. Because you fix only by this adjacent teeth. One middle, one distal from the line of the fracture. We need to use the splint. What about the upper jaw? It's the combination type of injuries. Because it's not only the lower jaw, it's the injuries to the upper jaw teeth too. Why? We start from the easy, continue and continue to imagine full picture. Yes. What we recommend? We need to remove the root and the destroyed, fractured, and the fractured part inside on the socket, second premolar.
Yes. Okay.
Yes. Need to see all. Understand what I mean? Yes.
X-ray examination, extraoral, panoramic. We have lateral and lower tooth. We have splints and the lateral incisor, upper and lower.
Not lateral. We have the splint technique by the sutures technique. You can see the splint around the two premolars, upper and the lower, from the adjacent. This is the milk teeth. Can you see it? And then we can use the resin elastic to fix it. And this is the osteosynthesis. What do you think? What's the idea? Why we save the impacted said molar?
Because the lower jaw can have any tooth that open and close without any tooth.
Why, guys, please? Why we save the wisdom, the impacted tooth from the lower jaw? Why we use the osteosynthesis with this tooth?
the fracture will increase.
Because it's not like the foreign bodies for the reposition, and we cannot use the technique of tooth extraction
Because you
now.
can't open.
Understand it why? We fix and wait. When it will be possible, we continue with removing the said molar. Okay?
The 5 months, yeah?
Yeah. Oh. It's how looks the patient with the problems with the upper jaw. Here with zygomatic. Can you see the configuration of the face?
Asymmetric.
Yes, here, no. Can you see? We lose the zygomatic bone. What we can find on X-ray? Of course, it's not X-ray. On X-ray, you cannot find, but we need to start with OPG. Then we continue with CT scan.
It's MRI or CT scan?
This is the CT scan. Perfect. How to understand? Can you see how change the configuration? Why we use always right, left, right, left, right, left? Yes, we need to separate it to understand where is it really. Yeah. This is about how we use if we lost the part of the jaw.
Artificial.
Yes, it's not the artificial bone, it's the special technique. Can you see that we lost the part? Can you see it? There was before osteosynthesis, but was broken the titanium plastic. At home start the chronic osteomyelitis. And we use the apparatus of Elizar's. Maybe you hear the Elizar was the doctor who creates this. It's the distractional osteogenesis. We use is traumatology on the leg, on the hand. We can use it the same in maxillofacial area. But how you understand that this is extra orally fixation? We have two parts, intraorally and one extraorally. Then with special methods of the screwing, we give the pressure, we wait 10 days and give and they change the direction of the screw. It's again why we use 10 or 2 weeks. This we need that they start the process of regeneration. Then you give the pressure and slightly open this process. Again, wait. It's like the stimulation of osteogenesis. We like a god who creates with this mechanical structure the bone.
We put it near to do regeneration after opening.
Yes, wait again. It's regenerate for next, then we again. It's very long time. Usually, it's about 3 months, 2.5, 3 months. Yes, sometimes bigger. What we need.
Every 2 weeks do this.
It depends. Yes, we under the control by CT. To understand possible, not possible, but by the rule from 10 days to 12 to around 2 weeks, we screw again, unscrew. Yes, please. Yes, guys, a little bit, 10 minutes and we're finished.
This image showing extraoral examination, specifically panoramic X-ray, and we can see upper and lower teeth, and there is a split of the upper and lower jaw.
Yes, teeth, yes.
And there is an angulation of the third molar for the lower jaw.
As the horizontal position is back third molar, yeah.
And what is also there is bulbitis in the first molar for the lower jaw, in the 46.
46, this one.
Yes.
Nothing. We can find two lines of the fracture. This one, when we discuss possible to use, yes. Possible. Endodontic treatment, yes, was. And this one, the line of the it's the canine, not mental canine. Two lines from one, you can see it, yes? Fractured, two. How many fragments? Three. Yes. Oops. We come back. Yes. Yes, please. Mikhail, yeah.
We see in extraoral examination, X-ray panoramic, we see the upper and lower teeth.
Jaw and teeth, yeah.
Yes, jaw and teeth. And we found not normal bone fracture.
Not found not normal bone. We found they changed the structure of the healthy bone.
Between the
Because when we discussed about the chronic periodontitis, how we answer? It's the process around the apex distraction of the bone, well formed, not well formed, and the size. This we can found.
Between
The line of the fracture.
the line of fracture between the first and the second from the
Lower jaw.
Lower jaw from the left side.
Which quadrant?
Third quadrant.
Third quadrant, yes.
What also?
Yes, how to understood again. We can use the splint technique, but before the reposition, we need to remove the second because the angle or the root in the line of fracture. It's like the foreign bone inside, it's impossible to reposit and fix to the right. Then we use splint and osteosynthesis. Understand how to answer, how to find, how to explain.
Yes.
Examination.
We finished.